Hello, I am Dr. Humberto Diaz. I am the Medical Learning Advisor for Valedictorian MD. I am from Guadalajara, Mexico, and I recently matched into internal medicine in the US. Now we're going to talk about the USMLE Step 2. The USMLE Step 2 is a little different from the USMLE Step 1. The exam itself is one block longer than the USMLE Step 1, but you also have maximum 1 hour of break. So it's a little longer, but for most people it's sometimes a little easier. Why is this? First of all, most people have already done Step 1, so they know what to expect. And second, the topics change. In the USMLE Step 1, it's 100% focused on foundational sciences. In the USMLE Step 2, we will be asked more about clinical sciences. So this is cardiology, pharmacology, applied pharmacology into a patient, etc. These type of questions will always have a clinical setting, different from Step 1, which some may and some may not. In the USMLE Step 2, most questions will be, what is the next step? They will picture a situation and then you have to decide what's the best next step. Should the patient go for an MRI? Should the patient go for a CT scan? Should the patient go home? You have to answer correctly. In this exam as well, the average score go higher than the USMLE Step 1. Probably it's because it's easier for the people that present this exam to get a higher score. The study materials for the USMLE Step 2 change a little bit compared to the USMLE Step 1. Kaplan lecture notes are great as well. There's also a book that is very commonly used, which is called Master the Boards. We can also offer this book to you for free. Here, the UWorld QBank is the most important resource that you will use to track your improvement and to acquire knowledge. Master the Boards and the Kaplan notes will help as the foundational science. The UWorld QBank will be the one that you will be using mostly, and as well is the one that you will use to track your improvement. In here, you can summarize either choosing flashcards or Master the Boards as well, which is only one book and has all the information that you will be asked in the exam. For the USMLE Step 2, there are also NBME exams that you can use to practice to get an approximate 3-digit score of how you're going to perform in the exam. We also have a study plan for the USMLE Step 2. This study plan is of maximum 6 months because USMLE Step 2 shouldn't take you longer than 6 months to study. This study plan is also divided in 3 different parts. The first part as well is acquiring the knowledge. The second part is to begin practicing questions while finishing the knowledge acquirement. And the third part is basically reviewing and test-taking strategies. This means questions. You also have some free days in which you can catch up or review topics that were hard for you when you were first reviewing. By the end of this period, you should be able to excel at your USMLE Step 2 exam. The people that have followed our study plan have had excellent scores in both the Step 1 and as well in the Step 2 exam. Thank you for watching this video. If you are interested in learning more about the road to a successful USMLE Step 1 or Step 2, please make sure to see our other videos that we will be uploading in this USMLE series.